when we started Ethnic Health Institute and looked at what should be our mission and what should be our goal. And the mission was very simple. We should try to improve the health of our community, the people that we serve. That was the mission.
When you define ethnic, that means everybody. And so that when we decided to create the Ethnic Health Institute, we took both a vertical and kind of a horizontal position. Horizontal in the sense that we decided on 3 different diseases initially: asthma, cardiovascular disease, and cancer. Later on we brought in diabetes. Vertical in that we looked at every community that was at risk from these diseases and decided to allocate our resources and our interests based upon the way in which those communities were affected.
Where there are good practices, we adopt those practices: prevention, early detection, mainly relying on prevention. And then you take that and carry that into the community. If you can prevent a disease, you are much better off, and that person is much better off. As a private physician, you cannot change the way chronic diseases present by staying in your office. You've got to adopt what the public health service does. You've got to make the public aware of what the issue is, about that disease. You've got to make it so that patients can come in and be screened, or early detection methods are available to them where they live, or easily accessible to them. And then you have to have some way of treating them. And so that was a valuable lesson for me to learn. So when we got the idea, of course, of how then do we institutionalize the community screening and early detection methods that we are doing in our community, I had that experience. The second thing you have to do on anything that you do, you should have allies. You have to have allies. Who is doing what about this initiative? Let's take high blood pressure. Let's take asthma. When we looked at asthma in our community, there were 85 organizations in our community doing something about asthma in Oakland and Berkeley. They had never talked to each other. 85 organizations. We call it the silo mentality, where everybody's in their silo, everybody's doing their thing, and that's great. But there's no uniformity, there's no structure, there's no integration, there's no maximization of results, there's no conservation of resources. So the first thing that we said, you have to have allies, and we have to be on the same plan. So we're saying, why don't we do that then in the community? Why don't we integrate these silos so that we're all on the same page and we're all flowing and going in the same mission, same objectives, and we're all maximizing our resources and supporting each other. That's the allied part. The other part is you got to do the research. You got to do who's doing what, et cetera. And you have to do the outreach part. You got to reach out and make it easy for patients to be seen and have access to screening and prevention thing. And then you got to educate the public, and you got to educate your providers.
It has been really a remarkable experience. I've never seen an organization get so many people together, get them to collaborate, bring their resources to the table, structure programs, get them working, and have them really integrate the community and produce results.
The Ethnic Health Institute has done a lot of outreach in the community, specifically with prostate cancer, hypertension, diabetes, and because I work with the Diabetes Committee, we've looked at doing provider training so that physicians are giving the appropriate care to their patients, that they know the most up-to-date information around care for diabetes. We've also done outreach to the community to inform them of who is at risk, why they're at risk, what can they do to prevent that risk, and then in turn, if they have diabetes, what can they do to manage and control it?
Organizations and agencies and public health departments continue to try to work closely and fund an organization such as the Ethnic Health Institute because they really focus on issues that affect our local communities, and they've been very successful in developing culturally appropriate programs.
Good health, and welcome to today's edition of Ethnic Health America. I'm your host, Dr. Mike Lenore. 1 out of 3 women will be abused at some point in their lives. Today we're going to talk about domestic violence. We'll be right back after this break. I think one of the things that we found was that about 50% of the American public gets all their health information from radio and television. That figure goes up to 67% for African Americans and 69% for Latino Americans. But consequently, if you look, you would expect to see a lot of health information on television. But you can go for several weeks and not see a meaningful message about how to take better care of yourself, how to recognize early diseases, what to do when you do make that recognition, and what to expect from the healthcare system when a certain diagnosis is made. And so we focused on primarily television and radio to try and get those kind of messages out about general disease issues, but specifically targeting how those issues impact ethnic minority populations, because they are the ones that we feel need the information the most. So we try to accomplish several things with media. One is to communicate messages that I think are far more effective than a lot of the written material available for people. Secondly, you can reach more people from a single focus if you do a radio or television program. And then I think to provide role models to the community so that they can see that there are professionals in our community that are involved in health, and perhaps these images or some of the radio pieces that we do serve as a stimulus for other young people to consider careers in those fields.
Funding is so important to any program. It's how you survive, it's how you run your program, it's how you're able to do your outreach. And with the outreach they've been doing, they've been able to detect issues that are life-threatening for people. Without funding, they can't have events that are able to necessarily do that because everything requires funding. They work in communities that need that funding, that need extra care because they're often left out. And so it's important that they have the ability to do those things by way of funding.
It is our obligation from the beginning to not only partner and listen to the community, but to also build their capacity to take on our role when we're gone. It's very sad to think about a grant ending and services are needed or programs are needed in the community, but you've left nothing behind and no one able to carry the work out. It would be an act of pure selfishness. And so I have to say happily for EHI, that's something that we don't do. We do all that we can all along to teach. We learn something, we pass it on. We develop something, we show people how to do the same thing. So if we do our work right, and if we help build the capacity of the community, then these projects and programs and services will be institutionalized and will be long-lasting, well beyond the period of the grant.
Some of the ways that the Ethnic Health Institute measures success is simply by the number of people educated and screened annually, which is over 4,000 individuals a year. In addition, we also advocate for policies that support healthy communities. When policies are passed, that's also a measure of our success. I think the most important measure would be the relationships that we build with the community and our colleagues and the trust that they have in our programs and services.
I am probably most proud of the fact that we are now recognized in the community as an asset, and that our partners recognize us as being worthy, that they feel very comfortable working with us, and the ability to work together. We leave our ego at the door. I always remember what my father used to say, and that is, you can get anything done that you want to if you don't mind who gets the credit. And I think that's the thing that makes me most proud.